Brendan Antiochos. I'm an MD. I see patients in the Sjogren Center and also do laboratory-based research in the translational lab. So the broad goal of the lab that I'm a part of is understanding the mechanisms behind autoimmune diseases. And my role there specifically is I work mainly in Sjogren's and trying to understand a specific part of the immune system which seems to be abnormally activated in Sjogren syndrome. And so that's this arm of the innate immune system known as the interferon system. And so this is a part of the immune system that gets turned on by things like viruses or certain bacteria which get into a human cell. And that cell responds by producing these interferons with the goal of trying to stop that microbe from taking over. So it's been known for a long time that in Sjogren's, as well as other rheumatic diseases like lupus, that this interferon system is kind of abnormally active. So my research focuses on trying to figure out what stimuli or what triggers are turning that system on and keeping it turned on continuously in the tissues that are affected by Sjogren's. The main dilemma in Sjogren's specifically is that we really don't have medicines that are overwhelmingly effective at changing the trajectory of the disease. So the goal of this research will be to try to identify components of the immune system which we could target with a drug which might actually change the natural history of Sjogren's. So kind of analogous to what's been done in rheumatoid where we have these sophisticated drugs that can target specific molecules and really do a lot to treat that condition effectively. The goal will be to try to find something similar for Sjogren's where we, to this point, don't have therapeutics that are clearly effective to that extent. So I think the most unique part about my job, the thing that I really value about it, is this interplay between clinic and the lab. So in my role, I have a chance to see individual patients either in the clinic or in the hospital, patients that are often challenging, either diagnostically or in terms of treatment decisions. And then I get to literally walk across the street and work in the lab where we're working often with blood or tissue samples from these same patients trying to understand these diseases. And so being able to see that spectrum of rheumatic disease from the level of the basic biology in the lab all the way to an individual patient, in the clinic or the hospital is the part of my position that I really find rewarding.
Great answer.
So I came to Johns Hopkins for my fellowship training. And when I was looking for fellowships, there were two main things that I was looking for. The first was rigorous clinical training. So I wanted to be in a division where I would see the whole spectrum of rheumatic diseases. And many of the conditions in rheumatology are not common. And so I wanted to be in a place where I get to see those rarer things and even the rare variants of those rare diseases. So it was clear to me that Johns Hopkins is a place where people are referred from great distances with complex rheumatic diseases. So that was one priority, and then the other priority was research training. I knew that I wanted to go into academics and wanted to have a career that combined clinical care of patients with research. So it was clear to me that this is a department that pursues both of those in unison.